am a migraine specialist. Before we actually start your exam, I would like to ask you a few very, very important questions, okay? So let's try to describe your headaches step by step, okay? When your headache first began, do you remember? Okay. How often do they occur? Okay. How long does each migraine usually last? Approximately. I'm very sorry. Okay. On the scale from 1 to 10, how painful are they? Is the pain sharp, trouble, dull, or pressure-like? Okay. It is usually one side of your head or both? Okay. Do you experience any blur vision while you're having the headache? Okay. Do bright light bothers you a lot? Okay, could you say it could be a starter of your headache? Okay, or a loud noise, for example. Okay, so I got it all. Now let's begin. Okay, beautiful. I'm very sorry, but now I'll have to point the light into your each eye. Okay, and for this I'll ask you to keep your head straight. Try not to blink as much as you can, but if you really, really need to, of course you blink, but try not to. Okay? Try to keep your head very straight. Okay, can you look directly at me, please? Thank you very much. Okay, try to look at my pen light. Okay, look directly at me. Now look at the pen light. Now directly at me. Now at the pen light. Now directly at me. Okay. Now I will ask you to tell me if this light become very uncomfortable for you. Please let me know. We will change it to the other one. Okay. It's a very bright blue light. Now I want you to look directly at me, and at some point I'll give you direction, like look at the right, look at the left, okay? But not now. Now you're looking directly at me. Directly at me. Directly at me. At me. Okay, now I'll ask you to look to the right. Look to the left. To the right. Now look up. Look down. Are you experiencing any blurriness right now? Okay. I forgot to take the drops. Drops. This drops here. Scales here. I'm going to give you a few drops and I'll ask you to blink for me. Blink, blink, blink. Okay, I'm going to close your eyes and you draw a big circle. You can make a cut here. I have to wipe the camera. Okay, a big circle. Okay, I'm going to open your eye. Can you tell me if this light here bothers you? Okay, I want you to look at my nose, please. Look at my nose, please. I'd like to examine your head. Don't worry, I'm not going to go inside of your head. With my fingers, I'll just give a little pressure on your temples. Okay? You tell me if it feels very sensitive. Okay? Or, for example, the back of your head right here. Okay? Right here. And we'll go a little bit more down to the back of your neck. Okay. A bit more pressure on your temples. Okay, I will give a bit more pressure on your temples and I want you to look right into my eyes, please. If you feel like you want to blink, you blink. If you feel like you want to close your eye, you close your eye, okay? Okay, now my fingers, I'll give a little pressure around your eye. Like here and there. Okay? On the corner. And now you'll give a little pressure on the back of your head. And slowly goes to your back of your neck. Like here. Okay. Now we need to hold your head straight. Okay, and look right in the center of my hammer. Okay. I'm gonna give a little pressure on your right temple. You'll do the same thing, look right in the center of my hammer. Okay, if you will do the same thing here, I'm gonna give a little pressure on your left temple. You look right. Oh, you look right in the middle of my hammer. Okay. I have a tool like this. Okay, it doesn't hurt, but one side feels a little softer, another side feels a bit harder. Okay, I'm gonna give a little punch tell me, was it softer or harder? If you can feel it. Now you'll see the difference. Now it will be more clear. Okay. Okay, I'm gonna go to the back of your head, okay? Back of your neck and a little bit lower. I want you to tell me if you feel where's back of your head, where's back of your neck, and lower. Okay, here we go. Now tell me, where do you feel it? That's right. Where do you feel it now? That's right. Where do you feel it now? Okay. Okay. Where do you feel it? That's right. Now. And now. Okay. I would like to examine your vision through the lenses, so I'm gonna have a few lenses, and at the same time I'm gonna give a flashlight, and I really need you to feel how it makes you feel and tell me. Some lenses might give you double vision, some lenses might give you a bit more pressure to your eye. This is what we don't want. This is what we are trying to figure out. Some lenses might make you feel good. In a way, you don't have that pressure anymore. Remove that pressure. Maybe not at the moment, so you will just have a few rounds go through. Okay? So now it's very important for you to feel how you're feeling. Okay? Okay, there's like lots of them. I'm not sure which one I want to start with. Okay, when you're wearing sunglasses, do you wear like full dark so your eye is not transparent to the other people while you're wearing them, or you like more transparent glasses where people can actually see your eye? So this is how you're feeling more comfortable. Okay, it's very important. So let's go. Okay, for example, I'm sorry for that. This is one of the light that was working. Supposed to. Sorry. I guess I have to charge it. Which actually I can do like now. Okay. Now let's give it a moment. I forgot. So in a blue light, okay, it'll be this light pointing through the lens, and it's supposed to make you feel better or might make you feel worse. Either way, I want you to let me know. Okay, let's start with this one. Okay, take your time. I want you to focus on me now. Keep your focus on me. At some point, I'll ask you to follow the light. Okay, now I want you to look at the light. It's okay, don't try to figure out how you feel, just look at the light. Okay. I'm gonna put this here. Okay, now I want you to look directly at me. Try to ignore the light. Okay, now look at the light. I'm sorry, light is very bright. Okay. I'd like to check this one now. It's going to be very different now. I want you to look directly at me. Okay, don't forget, if you're experiencing any double vision, I want you to let me know. Okay? Okay. Yeah, this is exactly how it's supposed to be. Okay, let's see something not as tent. Okay, I want you to look directly at me. In 1, 2, 3, I want you to look at the light. Okay. Now I'm going to put a very transparent this time the light will be a bit closer. I want you to focus your vision on me. Okay, don't look at the light. Just try to understand if light really bothers your eye. Okay. I have one more. Okay, look at me. In 1, 2, 3. I want you to look at the light. Okay. We have 2 more left. Okay. Tell me. Okay, look at me. Look at the light. Okay. Now you got it. One more. I don't think it will do any better, but still. Look at the light now. Okay. I'll hydrate your eye a bit more, just because we are pointing too much light. Okay, you can look right, left, up and down, or you can close your eyes and draw a big circles. Okay, now I'd like to examine your peripheral vision. I want you to keep your vision straight. I mean, if you're bored of me, you don't have to look at me. Just if you can look through me, that would be great. Tell me if with your peripheral vision you can see my finger moving. Okay, do you see it now? Okay, I'll make it wider. Okay, you focus your vision. Tell me if you can see it now. Can you see it now? Okay, I'm gonna change angle just a bit. You tell me if you can see it now. Can you see it now? Okay, let's switch the sides. You keep your focus. Okay, don't look at the finger. Just try to see with your peripheral vision. Okay, let me know if you see it moving. You just let me know if you see it moving. You just let me know if you see it moving. Great. Okay. I want you to follow the light. At some point you will see my finger moving. You let me know, okay? Just follow the light. See whenever my finger moves. Tell me. I'm sorry, yeah. Okay, whenever it moves. Great. Whenever it moves. Okay, whenever it moves. Whenever it moves. Okay. Look at the light. Can you see how many fingers I show you? Okay, look at the light. Can you tell me how many fingers you see? Okay, look at the light. Can you tell me how many fingers I show you? How many? Okay, how many? How many? Okay, how many on the other side? How many? How many? Well, that wasn't bad. Now, do you hear that? Okay. I want you to look right into my eyes because I need to see your eyes. Okay, look right into my eyes. On your left, whenever you see blinking, I want you to let me know. Okay, whenever you see it on your left, I want you to let me know. Whenever you see it on your right, or whenever you see it. Okay, whenever you see blinking. Whenever you see blinking. Okay, whenever you see blinking from different corners, you let me know. Okay. Okay, can you colors do you see? Okay. What about now? Okay. Look right into my eyes. Tell me, what colors do you see? Blinking. Okay. Blinking. Blinking. Can you tell me the colors? Okay. So I don't remember what you told me about the loud sounds, but I remember I asked you that. Okay. Okay. I'm gonna give a little wind to your ear. Okay. I'm not going to lie to you, that's for sure. Just a little wind. Do you feel it? Okay. Now the same wind I'm going to give to your eye. Okay, right on the corner. Okay, and I want to see your reaction. How will you react? Just try to stay straight. Try to keep your focus on me. Good. Very good. Okay, your right eye. Just, if you want, I can tell you something. Okay. Try to get you. Okay, good. Now, we'll do it one more time. This time I'll be a little bit closer. Good. Okay. One more time. I'll be closer. Okay. I'm going to give you the direction where I want you to look. Is my finger. I want you to all the time look at my finger, because unfortunately I have to put this light very, very, very close to your eye. Okay, look at my finger. At my finger. At my finger. Good. Very good. I'll ask you to follow something very thin. I want you to look at the top of the tool. Okay, right to the top. Look there. Keep following it. Now look at my finger. Okay, find the tool. On the tool, my finger. Look at the top, my finger. Look at the tool, 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 now my finger. Look at the tool, now my finger. Okay. Okay, now let's take a few deep breaths, let's see. Okay. Can you tell me the color? Okay, the color. The color. I'm sorry, why am I keep showing the blues? The color. The color. Okay, now I want you to, with your pointer finger on your right hand, point me the blue color. The blue circle. Okay. Now with your left hand, with your pointer finger, point the small orange circle. Okay. With your left hand, with your pointer finger, I want you to point the biggest green. Okay. With your pointer finger on your right arm, I want you to point the smallest red. Okay. With your pointer finger on your left hand, I want you to point the smallest yellow. Okay. With your pointer finger on your right arm, I want you to point the biggest blue. Okay. circle for me? Okay, the light won't hit the center of your eye. It will hit the corners of your eye. I want you to tell me if this light is still too bright, feels too bright. Okay? On the top, on the corner, on the bottom, on the corners. Okay? You look right here. Okay? Just try to feel how it makes you feel when light is hitting the corners of your eyes, the sides. Okay. Okay, unfortunately, the light that I need to use got broken. Okay, look right here. Okay. Well, I'm going to write what I think is right here, and I want you to show it to your doctor. Okay? I just think you need to get a better glasses. Calm yourself down. And maybe a vacation. That's what I'm subscribing you. Okay, beautiful. That's all I can do for you. Now it's up to you. I want you to take good care of yourself. Okay? Yeah, take a good care of yourself. You're very welcome. Don't forget to show this